Hello and welcome. Before we begin, we'd like to take a brief moment to share an important disclaimer. The views, opinions, and statements expressed on the Rascals Lounge podcast are solely those of the host and guests and do not reflect the views of any organization, employer, or sponsor. This podcast is provided as is and is intended solely for informational and entertainment purposes. Discussions on this podcast may include topics such as politics, vaccines, the pharmaceutical industry, professional sports, esports professionals and organizations, content creators, music, medicine, law, science, psychology, herbal medicine, supplements, cannabis, nicotine, alcohol, religious leaders, faith-based beliefs, and other related subjects. All commentary is based on publicly available information, personal experience, or personal opinion. Any references to public figures, political parties, politicians, athletes, organizations, religious groups, or individuals, living or deceased, are opinion-based and are not intended as factual claims or statements that could harm reputations. No content on this podcast is meant to defame, discredit, or negatively impact the reputation of any person, group, political party, religious faith, or entity. The host and guests expressly disclaim all liability for defamation, libel, slander, or any misinterpretation of the views expressed. This podcast does not provide professional advice of any kind. Comments or discussions involving doctors, scientists, psychologists, attorneys, athletes, religious leaders, politicians, or other professionals, including those related to health, training, injuries, performance, the pharmaceutical industry, herbal remedies, supplements, cannabis, nicotine, alcohol, vaccines, or alternative treatments, are intended for general informational purposes only. Listeners should never start, stop, or alter any medication, treatment plan, religious practice, legal action, financial decision, or substance use based solely on content heard on this podcast. Always consult with a licensed professional or qualified advisor in the relevant field before making any decisions related to health, law, religion, finance, or lifestyle. The host and guests make no representations or warranties regarding the accuracy, completeness, or suitability of the information presented, and disclaim all responsibility for errors, omissions, or outcomes resulting from the use of this content. The podcast and its content are provided as is, without any express or implied warranties of any kind. By listening to, reading, or otherwise accessing this podcast, you acknowledge and agree that the Rascals Lounge podcast, including its host and guests, shall not be held liable for any interpretations, actions, or consequences resulting from the content of this program. We strongly encourage all listeners to think critically, do their own research, and form independent judgments before acting on any topic discussed. Listener discretion is advised. Thank you and enjoy the show.
Welcome to the Rascals Lounge podcast.
Ladies and gentlemen, welcome to the Rascals Lounge podcast. Well, today we got a special guest. He is a physical therapist, and I am proud to introduce you to Dave Lorenz. Dave, how you doing?
Jeff, I'm doing great, man. Thanks for having me on. Really excited to have a nice discussion here. Looking forward to it.
Good. So, Dave, what got you into physical therapy? I mean, it was something that you just grew up on? You always wanted to be this, or?
No, not necessarily. I kind of got, I guess, exposed to physical therapy a little bit throughout my life. Luckily, I was never injured, but my parents, both of them grew up and they were in the nursing field. So I kind of was always exposed to healthcare growing up. And, of course, sitting around the dinner table, nurses going through it. All I heard at the dinner table is, you don't want to be a nurse. You don't want to be a nurse. So I was like, okay.
So true.
Yeah. I mean, that's anyone that I think has like nursing parents or anything can relate to that. So I that's what I knew. I kind of knew that, okay, I guess I don't want to be a nurse. So growing up, I just knew that I really enjoyed kind of giving back to people, playing sports, was involved in athletics throughout my whole life. So I actually went, when I first enrolled into Temple University in Philadelphia, I started as a sport management business major just because I was like, hey, I like sports, sports are cool. I'm a big, Phillies, Eagles, Sixers, Flyers, diehard fan. I was like, okay, we'll see what that career will go. One semester in, I hated it. Did not like business courses,
Wow.
the dog eat dog world of business just wasn't really for my personality. So that's when I kind of had a little bit of like a breakdown, hard conversations with my parents. And they were like, why don't you look into something healthcare? And I was like, I never thought about that before because I guess subconsciously I just always neglected healthcare because of those dinner table conversations. So when I thought about it, I mean, my dad tore his meniscus when we were playing baseball. He was kind of squatting down, playing catcher, popped his meniscus one time when I was in like 8th grade. When I was in like 6th grade, my brother tore his rotator cuff.
Mm.
arm wrestling someone at the lunch table. So I was exposed to physical therapy because I went to their appointments growing up. So then that's when I was like, okay, let me try some anatomy classes, kinesiology. Got exposed to PT and really loved it ever since then. So kind of that's how I was first introduced in the PT world. And I mean, I couldn't be happier with how it's gone since then. I have no regrets about kind of pursuing a career in this field.
Wow, amazing. It's funny that you said that because my mom is a nurse. My wife is a nurse. And I do EKG, so it it's really funny because my wife says the same thing to our kids. You don't want to be a nurse.
Yeah,
And
it's
she's a manager, she's management and I tell her, then why don't you just go take those 2 extra years and become a nurse practitioner? She says, I'm doing the same thing what they're doing. They come to me for help. So I was like, oh gosh. So it's just it's a really tough job. A lot of people think that nursing is easy. It's very tough. So I don't blame your parents whatsoever when they were just telling you
yeah,
don't be a nurse.
yeah,
It's tough.
it is. And I mean, you hear, I mean, of course, there are great doctors, bad doctors like everywhere.
Mhm.
And depending on the
Yep.
environment that you're in, if you have you could be in a great working environment and the nurses are really respected. Like, I work in a hospital. I really value and respect nurses' opinions and everything that they do for patients. But sometimes you still have some individuals that just really talk down to nurses and things like that. So it's an unfortunate dynamic still in our healthcare where there's too much like superiority complexes at work, whereas,
Yes.
there needs to be more of like an interdisciplinary collaboration where, hey, we're all in this together. We're all on the same team. Everyone has different roles on this team and brings different values to it. But unfortunately, there are still a lot of work environments in healthcare that aren't like that. And then that directly kind of negatively impacts our patients and their outcomes, which is why, as we know, healthcare in the US, outcomes are sometimes good, a lot of the times not good.
Mm. So true. So true. Because I know a lot of nurses that are really good. And when they try to give their opinion on something or say something, you know, they get brushed off or it's like, who are you? You're just a nurse. So it's like, oh God, it's not good.
Yeah, kind of stay in your lane, right?
Yeah, stay in your lane, but wait one second, doctor, you weren't here. She was there and she was doing all she can. And me as EKG specialist, I monitor these patients while they're in bed because she has 6 patients or I think there's about 6 maximum. And I'm calling her, hey, you got a patient here that's going on AFib, just converted or had a 20 beats of VTAC. She has to stop what she's doing, rushing over here to this other patient. It's a lot of work. They think it's easy, and it's not.
Yeah. I mean,
It's not.
yeah, it's not easy at all. I mean, they always have their hands full. And like you said, 6 patients. I mean, I don't
Yeah.
think the general person understands like how hard it is just to, I mean, be at a beckoning call of even one patient. I mean, most nurses work 12-hour shifts. I mean,
Yeah.
so I mean, the second that patient rings that call bell, nurse has to, try to stop what they're doing, if they're able to stop what they're doing. Of course, if they're with another patient, it's like, okay, I got to wrap this up and get to the other patient as quick as I can. But I mean, they're doing that constantly, and of course, documenting throughout for 12 hours. I mean, it's exhausting, and I don't think the general population really kind of understand and appreciate what we all in healthcare really go through on a day to
Yeah.
day basis. So, I mean, if we can shed some kind of insight on that to really get some type of appreciation from the general public, I think that would be, tremendous and just help with people respecting our professions as a whole.
So true. I bet your parents are like saying, "Well done. Thank you so thank you so much." That's what I wanted to hear from you.
I hope so.
Yeah. Oh gosh, it's tough out there. It's really tough. It is. It is. It's incredibly tough. I mean, it's a good field. It's one of the best field. I wish that my parents would have told me this when I was very young. So I didn't know because I lived in Puerto Rico. So everything there is tourism. You want to, build a business and have become a tour guide and all this and that. But if somebody sat down with me and say, listen, Jeff, go somewhere in the medical field, doesn't matter what it is, choose something in the medical field. That's what I tell my kids. I said, one, you're going to get a job no matter where you go. There's a hospital, tons of hospital in every state. As a matter of fact, around the world, there's a hospital. And they always need, whatever field you're going to be into, that they're going to need it. Even if it's EKGs or if it's nursing, doctor, a specialist, whatever, go for it.
Oh, yeah, for sure. I mean, I think, especially I have some family members, cousins, and in-laws that are still like in college now. And the big fear is, I think amongst those that are in colleges, what jobs and careers are AI really going to kind of replace, right? So, yes, of course, you can solicit medical information from AI, but, I think if you talk to any medical professional, I think you would agree with this is, yeah, you can get some decent information from AI, but you can't really replace, your doctor or your medical healthcare professional, right? So, I think there's a lot of concern of, there was a big boom in individuals majoring in things like engineering and things like that. But now a lot of those jobs are getting replaced with AI. So, it's something where healthcare, you look long term, that's something where it's going to be really hard to kind of replace that human interaction that goes on with human healthcare. So I would agree with you. My kids are still pretty little, but I would be thrilled if they eventually get into healthcare or something along the lines, or something that can't be replaced by technology, whether that's trade school, whether that's something in healthcare. So, as baby boomers continue to age and get older, and we're living longer, right? I think, medical professionals are going to be increasingly needed. And, the big mix match, is a lot of medical professionals left the field after the COVID-19 pandemic. So it's something where, there's certainly a need. I think, that like just about every hospital is running like pretty much short staffed or on a skeleton crew, and they're always looking for more help. So I think that's something where, if we can, if, there are some young listeners listening, medical professionals, there's a wide range of careers that you can go down, just do a little bit of research, see what you might be interested in. But I mean, it's a fantastic profession. And of course, some days are a little bit kind of more draining than others, but I feel like that's everywhere, that you're going to work, no matter what your career choice is.
What's really strange? You mentioned AI. That was one of my biggest fear on the field that I do, EKG, because I can't say that the company I work for or what software it was, but there's a program that we use that automatically, if the patient goes into, let's say, AFib, or they convert into whatever type of arrhythmia, it alerts the nurses first. And I said to myself, man, this is not good because it's doing my job. But it will alert artifact all the time. VTAC, boom, and the nurse will call me. Was that a real VTAC? I go, no, it's not a real VTAC. Don't worry about it. It's an artifact. It was so horrible that they discontinued it.
Wow.
And I was like, thank God. Because, I mean, anything. It was like, but it could not detect an artifact, and knowing that if it's real or not real, only a human can, because the patient can move or whatever, increase their heart rate, so automatically we'll think that. Sometimes when the patient is brushing their teeth, it shows a VTAC. And I will call, hey, patient's running a VTAC right now, and they will rush into the bedroom, and they were like, what's going on? Oh, he's brushing his teeth, Jeff. And just those movements. So you don't know what's real, what's not real, and AI cannot detect it. So it was just so horrible, and it caused what we call noise fatigue. alarm fatigue so much that to the point that we were getting alarm fatigue, the nurses were getting alarm fatigue, and they just like the company said, okay, let's discontinue it. And it was something that cost millions and millions of dollars just to put that software into the system, and they just like discontinue it. So I was really happy.
Yeah. I
Now,
mean, it's kind of like the boy who cried wolf in that scenario, right? I mean, it's something where, you're running to the patient's room and like you said, and okay, it's nothing, false alarm. So, I'm glad that they kicked that to the curb because I mean, that makes, all of your jobs even more exhausting
mhm,
because if you're running from room to room, false alarms, the big kind of point where we're seeing it around where I'm at in this area is when you go to the doctors and you kind of sign, you sign all those intake forms and things like that, there is, a lot of forms now that say, okay, when the provider is in to see you, do you mind if, this conversation gets recorded? And most of the time patients are like, yeah, that's totally fine. I have no issues with that. But what happens is there's a software that as you're conversing with the patient, it automatically starts to implement your documentation based off of what the patient is saying. So
mm,
it's kind of taking that, and in a way, it's great because it saves your time from okay, jotting this down, making sure you're getting all the pertinent information, and then documenting it at a later date. But of course, it's still kind of in its infancy, so you still have to go back and make sure and kind of proofread it to make sure that okay, it's actually picking up everything that was truly said, and there was no kind of aberrant information or anything like that. So AI, I mean, it's slowly kind of introducing its way into healthcare a little bit, but like you
mhm,
mentioned, I don't think it'll ever, hopefully not, take over
huh,
our important positions. But you never know. I mean, it's accelerated. I
yeah,
couldn't imagine where we're at with AI 3 years ago to how much it's transformed in 3 years. It's absolutely crazy.
it is. Well, there's one thing AI can't do is physical therapy. I know that for sure. So you're in a really good field. I mean, I mean, robotics and stuff like that. Robots coming and giving physical therapy. I highly doubt it.
Yeah, I certainly hope not. I mean, I know
Yeah.
that like if you say you're out gardening or something and you feel a twinge in your back or your shoulder or neck, yeah, you could put into any AI software, hey, I have pain and these are my symptoms and what could my possible diagnosis be? Okay,
Hmm.
great. What would a possible PT treatment plan look like in that? But a lot of big thing that we do is like manual therapy, right? Hands-on interventions for these individuals. I mean, AI, like you mentioned, even like a if there is a high-tech robot, I think to have them really master manual therapy skills, doing some what we call joint mobilizations to improve your range of motion, even various kind of other manual therapy massage techniques that we know, manipulations. I don't really foresee that kind of coming at the forefront in PT. Of course, maybe I think a robot would be able to stretch a hamstring or so because that's not too complex or complicated. But, some of those more in-depth manual PT interventions, I'd be very surprised, if those come about. But, Elon's doing his thing. He could develop, the next PT
Oh
high-tech
gosh.
robot. Who knows? But I feel good
Yeah.
about where we're at in healthcare so far about kind of AI staying in the periphery.
Yeah, me too. Yeah, that's wild. That's wild. Now, how many years you had to study to become a physical therapist?
Yeah, so it's 7 years total. So I did my 4 years of undergrad. And then usually they say like at the end of your junior year, as you're going into senior year of undergrad, that's when you want to start applying to PT school because it's about a year's length application process between getting all your documents together, submitting it to your various schools. And then a lot of schools will bring you in for like an interview, make sure that you're a good individual. You can converse easily with other healthcare professionals and professors because, as you know, being in healthcare, I would probably say 75-80% of your job is just being able to talk to someone and
Mhm.
kind of understand, having them understand what your role is, your findings. So then it's 4 years of undergrad. You get into PT school, and then PT school is 3 years. I know a lot of schools are kind of transitioning to a 2.5 year program. I just kind of err on the side of cautions with that because it's really hard to condense all that didactic knowledge that you have to know to be a PT in like say 2.5 years or 2 years. And then what they're doing is they're shortening, they're kind of front loading all of that didactic classwork activity. And then at the end, you're going on your clinical rotations for 6, 7, 8 months straight. But, I also teach in a PT program and, we're interested to see how the outcomes and data show that individuals with that kind of curriculum, how they do on their national board exam. Because at the end of the day, as you know, with any medical healthcare professional, yeah, you go to school for, 7 years, 4 years undergrad, 3 years PT school. If you don't pass that board exam, it's all for naught. I mean, you're not going to be a licensed professional. So at the end of the day, it's, can you pass that exam or not? So in total, it's 7 years. I was a little bit longer because I did take a gap year in between undergrad and grad school. I worked as a rehab technician or what we call a physical therapy aide. I was in the clinic just kind of helping out, seeing how a PT clinic runs day to day because it's a big investment, right? Any type of school, especially grad schools, big financial commitment. I wanted to ensure 1,000% that is what I wanted to do before I took on, some loans and debt and things like that to go to PT school.
Yeah, it's a lot of money. It's a lot
It
of
is.
money.
It certainly is. And that's,
I know doctors are still paying for the
yeah.
cost.
So it's one of those like kind of again, you sit at the round table with my parents to talk
Yeah.
about even my girlfriend at the time, who's now my wife. We were saying, okay, this is what we're going to be undertaking. And this is what we're, financially, monthly payments wise, what we're looking at. I will say that, of course, now it's kind of up in the air. There's a lot of things changing in this political climate, as we know.
Mhm.
And I think student loans is one of them. Of course, I don't think that enough is done with that whole student loan crisis. You have a lot of people going into default because they can't afford their payments. But I'm fortunate because where I teach now, it's a kind of public university. So it's one of those, I technically work for the state of Maryland. So I'm on a public service loan forgiveness program. So essentially I pay 10 years of loan payments and then whatever is even my remaining balance after those 10 years, it's all forgiven.
Oh, really?
Yeah. So
Oh,
that's an
good.
option. That's always an option. I mean, of course, it's rumored to be on the chopping block, but I don't see how they're ever going to get rid of that. So for those that may be listening that are on the fence about, going into any type of healthcare profession and they're worried about the debt that they may take on, if you work for, the state or, somewhere where there's an area of need, a lot of times those institutions qualify for what we call the public service loan forgiveness program. So you pay payments for 10 years and then no matter what your balance is at the end of those 10 years, it's all kind of wiped away at that point. So it's a great option.
Upgrade your screen time, whether you're gaming, working, or just browsing, with Gamer Advantage blue light blocking eyewear. They are expertly crafted for gamers or for anyone that's in front of a screen for long hours. Featuring Resme lens technology, these glasses are engineered to minimize digital eye strain and shield your eyes from the detrimental effects of blue light. Doctor recommended, potentially boost focus and significantly enhance sleep quality, ensuring you stay at the top of your game. Visit gameradvantage.com for more information and use promo code RASCALS at checkout to get 10% off your purchase. I do earn a commission when you use the promo code, which helps sustain and grow the podcast. Once again, visit gameradvantage.com for more information and use promo code RASCALS at checkout to get 10% off your purchase. Well, folks, there you go. If you want to go to become a brain surgeon, go for it.
Take on as
Yeah.
much debt as you want. Just
Yeah,
make sure that you
take
get
as
a job
much.
that qualifies
Yeah.
for that at the end.
Oh gosh. Do you feel that a lot of students kind of like hold themselves back into becoming what they want to be because of they know the debt loan they're going to get into?
For sure. I mean, it's unfortunate because as we know, I forget what the exact like data and numbers show, but I mean, even just undergrad tuition has risen astronomically within the last, 10, 20 years, or so. And I mean, once you get to grad school, it's even more expensive. So I feel like, unless you have a scholarship for undergrad or even a scholarship for grad school, if you don't really come from, I guess, like upper middle class, a lot of individuals are like, I don't know if I could do this. I was fortunate because, like I said, my parents were both nurses, right? So they worked
Hmm.
at, both of them worked at a hospital that was affiliated with the university. So I
Okay.
essentially went for a significant discount for undergrad. So I didn't really have any debt or loans coming out of undergrad. It all just kind of accumulated in grad school. And, even when I was in high school, that was my parents, they kind of sat me down and said, listen, undergrad, if you go to this university institution that we're affiliated with, you'll be taken care of. If you want to go elsewhere, it's on you. And if you want to go post grad, like grad school, that's going to be on you as well. So, just having those conversations and, I think kind of being honest, if you're a parent listening and you want to have those conversations with your kid, I think it's super important. But I do think it's unfortunate that students look at things like debt to income ratio and they're saying, oh man, rent and mortgages are high, utility bills are high, groceries are high. Can I really afford a student loan payment on top of that, especially if you have things like car payment, cell phone? So I do think a lot of the times, that's why I think we're seeing a huge boom in trade schools too, because it's just something that people look at the debt, kind of scares them away, which is unfortunate. Hopefully something can be done about that.
Hmm.
But it's another conversation for another day because, we could talk about that for hours, I feel
Yeah.
like. But yeah.
Yeah. So true. A lot of hospitals do offer programs to nurses, um, because they're affiliated with some colleges and stuff. And they even offered my wife, like, if she wanted to go ahead and do to become a nurse practitioner, it they will pay half of it. She pay half, and they will pay half of it. So there's always an option out there, which is a good thing.
Oh,
Because,
yeah.
I told her, a lot of people get this is they just like they get freaked out. Oh man, it's gonna be so expensive. And but if you work for a hospital, sometimes they have a lot of programs that like, hey, if you, but they want you to stick with them. That's the that's the point. You graduate, you finish, but you stay with us. We keep you. You still be part of us, but when we'll pay half. But if you try to leave any sooner, then you gotta have to pay the full bill. So it's kind of like, but there's pros and cons to it. But I mean, it's a good thing. There's always a way to 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 find ways to do what you want to do to get into your career that you want to be into. So wow, so with physical therapy, I know a lot of friends of mine, they get confused with chiropractor and physical therapy. Do you get that a lot? People are like, okay, can you snap? Can you crack my back? And you're like, I'm a physical therapist. I do totally different than that.
Yeah. So that's a great question. I mean, it's something that I think the general public is very kind of confused about. Even one time I was at a party with my in-laws and my mother-in-law, she's like, oh, how's the massage therapy going? And I'm just like, I'm not a massage therapist. I'm a physical therapist. I know massage techniques because that's what I've learned in PT school,
Yeah.
and things like that, but it's totally different. So I mean, real quick, like PTs, we describe ourselves as like the movement experts, right? We know human anatomy inside and out. We know how the body is supposed to move in its most optimal and efficient way. And if there's, any dysfunction or impairments in that, we really have a trained eye to, it's funny. My wife makes fun of me all the time because, something a big part of what we do is like observational gait analysis. So even people, we live close to the beach, people are walking up and down the boardwalk. I'm like, ah, man, they got a weird kind of gait pattern or the way they walk. I wonder what's contributing to that. So we kind of have a trained eye to do those certain things, identify their deficits, and then kind of come up with interventions to fix that, whether that's exercise, whether that's hands-on manual therapy, implementing modalities like, electrical stimulation, heat, cold, things like that, dry
Mhm.
needling, different techniques. We do learn as you're in PT school, we do learn how to do what we call grade 5 mobilizations, also known as a manipulation. So we do learn those kind of quote unquote cracking techniques, things like you can crack your mid back or lower back or crack your neck. I would say that chiropractors are probably more adept at that because they have more training with that, but a PT is trained with that. Whereas chiropractors, they're really focused on skeletal manipulations and adjustments, whereas PTs are more so, movement dysfunctions and how to really optimize movement, improve quality of life. And then, of course, your massage therapist is just, an individual where you go to massage therapy and, you're getting kind of hands-on treatments for, say, 30, 60, 90 minutes. A PT session is more like, okay, you may get some hands-on treatments, whether that's joint mobilizations, stretches, massage techniques, but we're probably going to be doing hands-on techniques 10, 15 minutes. And then the rest, we're going to be doing some structured exercises and making sure that you're doing them effectively in order to address those deficits, whether it's decreased range of motion, decreased strength, decreased balance, you name it. We kind of have to be like a little jack of all trades in that sense.
Man, where were you when I got I still do, tennis elbow?
Oh man, that's a tough one. That is one that can linger
Oh,
for a long time.
been
I've had
months now. I think
yeah,
like 2 months with it. I mean, thank God it gradually it's still low, but I still feel it. I'm like, man, this is horrible. How can I get rid of this?
yeah,
It's a
I mean,
pain.
it's definitely something where I would love to help you out with that, because it's something where, especially that one, like tennis elbow, and there's a lot of injuries or diagnoses that are overuse injuries, right? It's just repetitive injuries. You're doing the same thing almost on a daily basis. And in order to really kind of address that, we got to get to the root of the issue,
Hmm.
looking at your wrist range of motion, looking at your grip strength, maybe even looking at range of motion in your wrist, elbow, and shoulder, kind of addressing that whole kinetic chain, and then implementing some, teaching you some, self, techniques that you can do on yourself in order to kind of address those kind of increased tone or pain in those muscles. And then
Hmm.
also just some various stretches and exercises that you can do to kind of address that. But tennis elbow, I mean, I've had a bunch of patients that I've worked with where they get frustrated because they want it gone, yesterday, right? And it's something where it's like, no, this is going to take a little bit of time because unfortunately we need to use our hands on a daily basis.
Correct.
And it's going to kind of provoke it a little bit, but you just have to try to modify your activity. So that is one where it can take a little bit longer than expected. And it's a pain in the ass, really.
It is.
Yeah.
It's a pain. I got it playing pickleball, man. My kids got me into pickleball. And then I don't know what I did. I made sure I got a really good paddle. It's expensive. It's a Wilson that costs like 200 some bucks. I wanted to make sure it's super light and not the heavy, cheap ones. And it was really good. But I'm playing and all of a sudden I'm feeling this pain. So I didn't go Dr. Google, but I did went Dr. Chat GPT.
Yeah.
So,
Yep.
what's this pain I feel in my, explain. And tennis elbow. I was like, oh gosh.
Were you throwing a lot of backhands like in pickleball, like hitting the ball like
Yeah,
back?
yeah, the backhands, everything. Because you got to move your arm constantly all over the place. And the thing is, with pickleball is a short range instead of tennis is longer. You're further away.
Yep.
But this one, you got to move back and forth real quick, and you're just moving everything, your arms, and you're just swinging, and I'm like, man, and the pain was really weird. That what I found is that I could have the pain, but the pain comes afterwards when I'm cold,
Yeah.
and I'm at home and I'm laying in bed and I wake up, I just feel that pain really horrible. If I go play and I'm warming up and playing again, then the pain goes away until I stop. When I stop playing, the pain comes back. You feel it. I was like, okay, that's so weird. It's like if it, so, I don't know if it's the muscles or joints or whatever. If they get warmed up, it kind of relaxes everything. But then once it gets cold, it's like you feel that pain again. It's like it's horrible, and it's lasts a long time. And I was freaking out. So I asked, obviously, in the hospital, I know tons of doctors. I got a question. I got this, and it's a tennis elbow. Does this like 2 or 3 weeks? He goes, 2 or 3 weeks? I wish. He goes, talk about 4 months to 6
Oh, man.
months.
Yeah.
I'm like, geesh.
Yeah.
That's a pain.
It is. And it's one of those, I mean, think like what you were just saying, pickleball, a lot of repetitive movements, right?
Mhm.
Forehands, backhands, you're swinging your arm all over the place. Like you mentioned, once you get warmed up, you got some blood flow going to those muscles. It feels pretty good. You got blood flow to the area. That helps with just reducing pain, improving function. But then, like you said, once you stop, then that blood flow kind of reduces to that area. That's when your kind of pain receptors are going to kind of increase at that point. And it's a drag. I mean, you have in pickleball, so the things that really kind of can flare up tennis elbow are what we call repeated wrist extension. So kind of when you're doing that type of movement, kind of bending your
Mhm.
wrist upwards towards you. And then also gripping. So you're gripping a paddle and you're swinging that wrist all over the place. So it's something where, those two movements, you're doing it for 30, 60 minutes or so. It's just a repetitive overuse strain injury. And 4 to 6 months sounds about right. I know people probably listening are like, man, that sucks. Like, that is a long
Yeah.
time. And I always try to tell my patients is like, whatever you think how long it's going to take, it's probably going to be longer than that. Our bodies are great at healing themselves, but we really need to give them time to heal. And, unfortunately, as we continue to age, even if you are an active individual, our body just kind of slows down as we age. Things, we're
Yeah.
not as elastic or flexible as we used to be, and our general just tissue healing just is a little bit more prolonged and delayed than someone who's 18, where you fall off your bike, you get a bunch of bruises and scratches, and maybe you pull a muscle, but then 2, 3 days, oh, I feel good, I'm fine. That's unfortunately not the case for us. It could be
Yeah.
2, 3 weeks, 2, 3 months. So it's just important to kind of be realistic with those time frames and kind of appreciate that.
So true. And I got friends and a lot of listeners are into gaming, and I have a professional pro league player uh, contacted me, and we were talking, and he was suffering from carpal tunnel because the wrist, because he has to use the mouse in order to play and all this stuff. And he's like, "What the heck is going on? I have this pain," and I was like, "Man, okay. If you talk to me about the heart, I know, but let's talk. Let me get my wife." And my wife's like, "That sounds like carpal tunnel. You're gonna have to see a physical therapist for that." And you're just sitting down. You're in the
Yeah.
office. You're in front of the computer, and you could just get injured just by that. Like, what
Yeah.
the heck?
You would think, okay, like PTs, we see individuals, like you mentioned, that get hurt doing active things. And that's really not the case at all. And I mean, especially, I've treated some gamers before. And then also, once kind of COVID happened and, a lot of individuals started working remotely, a
Mhm.
lot of more increased back pain, neck pain, because of, poor, work setup. You have your desk or work from home. So that's another thing that PTs have to be trained in, is be able to know proper ergonomics. Like, okay, in order to reduce strain on your wrist, on your neck, on your lower back, this is how your chair should be positioned. These are the features of a good chair, like a good gaming chair, for instance, or even a good desk chair. Qualities of a good height, how far your monitor should be away from you, the orientation of your hands and elbows. So kind of all that stuff. And, even sitting there, because I like the game as well. You could be sitting there and it
Mhm.
feels like you're only there for an hour. Next thing you know, 3 hours have passed. You're using a mouse, you're compressing that kind of area, what we call kind of your carpal tunnel. And that's
Mhm.
going to impact that nerve. And, that's when you get those kind of feeling like your hand falls asleep in certain fingers. And once you get nerves related into it, I don't know if I feel like everyone's kind of hit their funny bone before, right? I mean, that's like
Oh
when you're
yeah.
hitting a nerve and you're like, ooh, imagine that kind of unrelenting, right? You just feel like your arm's asleep or certain fingers are asleep. And no matter how much you try to shake it out, it's just ongoing. And those injuries can be very frustrating. And again, like we said before with tennis elbow, it takes a really long time to eradicate those issues.
Wow. That's crazy. Yeah, it does. It does take a long time. It's kind of strange because now, like you said, a lot of people during COVID they went remote, and now they're getting, which is a good thing for you because it keeps your office busy. But it sucks for us that they're into gaming or stuff like that. I'm like thinking, okay, man, carpet tunnel must be on the highs. You get that a lot? You get more patients into that, or you get a lot of injured patient from accidents?
I would probably say most of them just occur. Honestly, most like injuries occur from being too sedentary. And then after you're sedentary for a long period of time, like say you're sitting for a long period of time and then you try to do something physical, whether it's even lifting, a box of say Christmas decorations or so, but you do it like improper form with trying to lift a thing, or you're emptying a dishwasher and you're kind of staying flexed at your trunk and you're pivoting, and then you feel a twinge or something in your back. So I would say most of that is just general orthopedic injuries. We see a lot of just general low back pain, neck pain, shoulder pain, knee pain from like arthritis or what have you. Also carpal tunnel. We do see, of course, some that are direct correlation, like, okay, I was running, I probably took too long of a stride, felt a pull in my hamstring. Those are our easy cases. That's like, okay, that's a direct
Oh,
correlation. We know how to,
really?
yeah, we know how to fix that. I mean, you can clearly identify the cause of the issue versus
Uh-huh.
someone that's like, you know what, I was just sitting one day, and all of a sudden, like over the last 3 or 4 weeks, my back pain's just been getting more increased. So then it's like, okay, we need to dig a little bit deeper and find the root of the cause. But that's kind of why I love PT, because there's variability in every single day of like, it's kind of like trying to figure out a puzzle as to how did this occur for this individual, and then how can we try to fix it and ensure that it doesn't come back.
So I assume that a lot of these professional athletes that are in the NFL and hockey and basketball, they have to go through physical therapy probably a lot. Cause
Yeah.
I see some videos that they're all in the locker room, they're getting these massages by massage therapists, and then they gotta, seek physical therapists therapy all the time, sorry. And get these helps. And I'm like, man, they're just like always in physical therapy. And now my thing is a lot of times when they get injured, is steroids always have to be some medications that involve steroids have to be involved, or a lot of times they don't, because that a lot of these players are so kind of like scared now, freaked out because they get some type of steroid to help heal their muscles or whatever they need to get healed, and then they're hitting some home runs and they're like, oh, he had steroids on him system, so now we're gonna have to you know not put him on the Hall of Fame or something. And I always thought of that. Okay, a lot of times they need these steroids to heal.
Yeah. That is a great question, because a lot of the times, like say, even let's take for example, you're doing something and say you turn or something like that, and you feel a twinge in your knee. You go to your
Hmm.
doctor and they prescribe you like a steroid, right? That's going to, in short-term dosages, like having like a corticosteroid or something like that can certainly help reduce inflammation, reduce your pain, and get you back, a little bit faster. But there are a number of studies out there that have shown that long-term chronic use of steroids or corticosteroids. So a lot of the time, say for an individual that has had some knee osteoarthritis for 15, 20 years, and they've been taking a steroid daily because it helps address their pain, gets them through the day. Long term, that actually damages your joint and your cartilage, uh, and you're doing more harm to your body than you even know. It's going to continue to break down that joint and your cartilage, and it's going to, long term, it's going to catch up with you. So if you're someone that's
Mm.
had got knee osteoarthritis, you've been taking a steroid for 15, 20 years, you're really kind of accelerating your path to potentially getting like a knee replacement. And that's not too surprising because think like almost what you mentioned with like professional baseball players back in like the 90s, early 2000s. A lot of those guys were taking those anabolic steroids. So, when they're
Mm.
juicing and the guy's got like huge muscles, they're hitting home runs. But as a lot of individuals may or may not know, when you take even anabolic steroids, you're kind of increasing your susceptibility to an injury. You're kind of asking too much on your muscles and your joints. So a lot of those times, those bodies, start to break down because long-term use of steroids isn't good for your body. Look at, bodybuilders that have been doing it for a long time. I think the one that comes to mind is like Ronnie Coleman. He was Mr.
Oh,
Strongman.
yes.
Yeah, and I don't know
I
if you've
saw
seen, but he
that.
can hardly walk now. Um,
Yes.
a lot of
I
he's
saw him
had
crawling on the floor and he
yeah,
couldn't stand up. I was like, wait one sec, this guy would lift up 400
yeah,
pounds, bench press, anything.
I mean, it's a combination. I think he's had some back injuries throughout his life. So, I mean, obviously, you're lifting that heavy, any type of aberrant movement or something can cause, a back injury, especially when you're doing like heavy squats, like you mentioned, or heavy deadlifts to the weight that he was doing. But I'm sure he was taking some type of supplements that, if you factor in the injuries plus the long-term use of those possible supplements that he was taking, you look at him now. I mean, I think he's in his 60s, and like you said, he can hardly walk. He's kind of crawling around,
Yeah.
and that really shouldn't happen. I know, you think, oh, as we get into our 60s and 70s, we just wave the white flag. That's not really how it should be. I've treated patients that I think the oldest patient I had was 102, and they were walking just with a cane. So, I mean, that shows you that if you
Wow.
take care of your body, it can last for a very long time. Of course, luck and genetics plays into it as well with your family history. But, when you're taking those medications, supplements long term, eventually it's going to catch up with you.
Wow. That's true. You could tell the difference. I mean, when you could tell the difference from a person that uses natural supplements versus a person that is into steroids. By the muscles, you could just tell the difference. Like, okay, this seems more natural than this.
Oh, yeah.
This is like way extreme.
Yeah. They look like Popeye, right? Or like a
Yeah.
cartoon. Yeah. I mean, I always, the two biggest calling cards, like you mentioned, like their muscles are just like cartoonishly massive. And then also like, your blood vessels, like you see the veins like popping out like in every single kind of, joint. You just have those spider webs of veins kind of going all the way up in their arm into their shoulders and their pecs. That's not really natural. Of course, you're going to have some of that just by, if someone's, a power lifter and they lift a lot, naturally you're going to have, of course, some veins that are showing through. But I mean, if you, of course, do a quick Google search and you kind of look at body types of individuals that have done steroids versus those that haven't, it's pretty clear. You can identify which ones are natural and which ones aren't.
Yeah, that's true. You could tell the difference. You could tell the difference. Man, so you're a gamer too.
I try to. I got two young kids now, so of course that takes up a lot of time.
Mm-hmm.
But shoot, man, when I was in high school, college, I mean, I was a big PlayStation 2 guy when it first was out, and then
Mm-hmm.
once my brother and I got hooked on Halo, we kind of switched over to Xbox. Been on the Xbox train since. Some of my all-time favorite games are the Halo trilogies and all the Halo games. Your
Yeah.
Call of Duties, Gears of War. I mean, that's probably my favorite franchise of all time.
Yeah.
And then things like NBA 2K, Madden. So, I play a little bit of everything. And now, of course, with having, two young kids, my gaming time is very kind of
Very
shortened,
limited.
but my
Yeah.
son's at the age now where he's getting into playing the Switch, so we play a lot
Okay.
of like Mario Kart and things like that. Gaming's always been, a big thing for me. It's just
Yeah.
been a nice outlet to just kind of get away from the real world, kind of dive on into a good game, and then I just love that, you're sitting there enjoying yourselves, and you look up, you're like, oh shoot, 3 hours has gone by. I should probably get out of the basement and say hi to, humanity.
Yeah. It's true. I mean, it's like I tell my wife, it's like gaming for me is it's a stress reliever. I'm getting out of the world, my job, the stress and all this stuff. And when I just get into gaming, it's just like I'm just out. I'm relaxing now. Feel better. Even though certain games are stressful, and especially Halo, because I know a lot of pro players on Halo, and they go through a lot of stress because they have to play constantly and practice all day. And for them, they see it as a job. And if not, they'll get kicked out of the team. If they get kicked out of the team or an organization, then they don't make any money. But yeah, for me, it's like that. Just get out of the real world and have some fun. That's good that you do that because I mean, to be a doctor in the field you're in, it's not easy. It's not easy at all. And I know a lot of patients, when you're just helping them, they're complaining about the pain and you could hear the yells, a scream, oh, it's like that hurt, and you got to help this person walk again after some type of accident. I don't know how can you do it. And there was one time I wanted to be an assistant. I wanted man, I like physical therapy. I like that. I like helping people. You have to have that heart and soul to help people. And I said, whoever has this profession loves people, loves mankind, wants to do the best for humanity. But yeah, but at the same time, you need your moments to get away of all this stuff and of work and go fishing or go playing tennis. Probably, I don't know if you play tennis, but or pickleball or probably golf. I don't hear
Yeah,
too many people get injuries in golf, but
I am a big golfer. So actually, when I was in PT school, my first year in PT school, I would joined a flag football league with my brother. I played football, baseball, basketball my whole life. And it was flag football, but it got pretty intense. We're in a championship game. I actually jumped, and as I was playing cornerback, and I tried to deflect a pass, and when I landed, my foot got caught in the turf, and my momentum kept carrying me forward. I
oh,
knew right away because I heard a big snap. So I actually fractured my fibula, which is kind of one of your lower leg bones. It's the outer kind of ankle bone. I
hmm
fractured that, tore a couple ligaments in my ankle as well. So I was humbled myself because at that point, that's when I went through PT. It happened in like March, and I wasn't really back to like running for about 3-4 months because I'm non-weight bearing for 6-7 weeks at that point in a cast, um, and it really gave me more empathy to understand like, okay, this rehabbing from an injury sucks. I mean, it's a lot of mental kind of games that go on. You're like, am I going to be able to get back? When am I going to be able to get back to normal? When am I going to be able to walk normal again and not feel this pain? So for folks that go through like major injuries, like, tearing your Achilles or tearing your ACL, I really emphasize with those individuals because those are even more long-term injuries. So, and then like you mentioned, for those that are maybe thinking about PT, being a PTA is a good alternative because it's one less year of school. So, and it's a lot of the times it's in you go to, say a community college, that's where they have like PTA programs. It's an associate's degree. So you're paying really a fraction of the cost compared to what PT school is. Still a great field, still a great career. Your kind of career growth and career trajectory may be a little bit kind of limited compared to that versus a PT. But I mean, still a solid career, solid earnings that you'll get, and it's, less debt that you'll take on. So, that's always an option as well.
yeah, the assistants, yeah. PTA, yeah, it is a good field. That's one of the fields I recommended quite a few family members because they just didn't want to go study so many years, and I said, well, become an assistant, be a physical therapist assistant. that will help you out. It's a good field. You'll make good money. You won't make as much as a as a doctor, but you're gonna make good money, and you have a career. A lot of people just get confused because they think, okay, if I become an assistant, the doctor is gonna put everything on me. Let me do everything. And I'm like, no, not necessarily, because remember, the doctor also is not going to risk their license, uh, taking a risk on something that they know that you can't do, and they're kind of picky with that.
Yeah. And I mean, if I could like real quick, the easiest way, if folks are maybe a little confused, PT versus PTA. PTA can do a lot of things like you mentioned that a PT can do. Essentially, the difference is a PTA cannot do an initial evaluation or examination on a patient. Let's say, for example,
Mm.
you came into my clinic with a prescription that said, okay, my primary care physician or my orthopedic doctor thinks that I have tennis elbow. I'm going to say, okay, great. The physical therapist is going to be the one that sees you for that initial kind of session. And we're going to evaluate you. A lot of times it's about 40 to 60 minutes of really one-on-one time where we're doing our measurements and our assessments and our tests to see, is this really tennis elbow? Okay. Likely so, depending on our, examination results. And then the PT really creates the treatment plan. Okay, these are the techniques we're going to do, hands-on techniques. These are the exercises that I want Jeff to do. But, at that point, you hand that off to the PTA. And then, PTA is going to be really sound clinical reasoning, clinical decision making. So like the PT kind of creates the roadmap and says, this is generally what I want to do. But you give a lot of autonomy to the PTA for them to kind of come up with some of their own kind of unique exercises, or as far as, okay, when is Jeff ready for the next progression or phase in his program? So the PTA gets a lot of leeway and freedom with that. They're just kind of following general directions from the PT.
Wow, that's interesting. And they also cannot medicate, correct?
Correct. Yeah. And PTs, so it really depends on state to state. Still, most states, we can't really prescribe any medications. One area of kind of uniqueness where PTs are able to do that, where we can order imaging, we can order medications, is like those that are involved in the military. A physical therapist in the military, they have a lot more autonomy and freedom to be able to do that. But there are certain states that are kind of pushing for that, for a PT to be able to say, I think you may have maybe a herniated disc in your back or neck. I want you to go kind of get an MRI or something like that, versus I go see my doctor. They tell me to try PT for 6 weeks. PT is not effective. I got to go back to my doctor to get the prescription for an MRI. So it really depends state to state. And actually, I think Utah just recently has been like the first state that really has labeled physical therapists as primary care providers for just your standard musculoskeletal or neuromuscular injuries. So say you pull a muscle or something, you can go to a PT directly, and that'll be like your doctor versus going to your doctor who then says you need physical therapy. So it kind of really condenses the time for that patient. That way they don't have to make multiple trips in order to get into the door of PT. So more states are trying to go down that route and have PTs be like your primary care providers for those standard run-of-the-mill orthopedic injuries. So I would expect that to continue as we move into the future.
Man, that would be amazing.
I hope so. Yeah.
Oh gosh, because I already know certain things that I know I have tennis elbow. Why go to the doctor for the doctor, then to go ahead here's a prescription, here you go, I need you to do this and then that, when I could just go straight to a physical therapist.
Yeah, I mean, you're exactly right. It saves the patient time versus, like you said, you go to the doctor, they write you a script for maybe a steroid or something like that. And then they say, okay, we'll try this for a couple weeks. If it's not working, come back and see me.
And
2 weeks goes by. Yeah. So you're paying multiple copays for them to eventually say, that didn't really work. Maybe we should try PT.
Yeah.
It's like, that's one of the biggest kind of disconnects still in our profession. It's like, for those, I know doctors are great. They have a lot of knowledge. about a lot of things. Sorry, that was my dog barking, but he is,
Oh, you're good.
but we are really the movement experts as far as, certain exercises and orthopedic injuries that we can implement. So, we'll see as more and more states try to implement that, but I think it will kind of take off here.
Mm, okay, good. Well, Lorenz, I want to thank you so much. I know the time is of essence, and I know you have a busy life. And I could tell the dog is already letting you know, gotta get going. But man, thank you so much. This was phenomenal. I love learning all new things, and I was like, man, I couldn't wait to get you on. And I know you were kind of like, how do you heard about me? Well, it was Dr. Morse, so through him and through all other groups, because you see who they follow, who follows them, and then you try to make friends with all of them. And I said, okay, I would really like to get somebody that's into physical therapy, what they know, and what's the difference between that and a chiropractor. And because a lot of things you see online and see on TV and the sports, all these injuries and stuff, I just love to learn. Just love to learn.
Yeah, and I would say those that are really in like healthcare, I mean, we kind of are like those lifelong learners, right? We know what we know, but we also know what we don't know, and we just want to be educated more on that. And like you mentioned, it was pretty unique in how we kind of got linked up, just because I
Yeah.
have done some work with Dr. Morse for a few years now, and that's another side thing that I do is, usually once a week, Dr. Morse lets us use his channel, and we'll talk through like NFL injuries that have occurred, during that week. So like I said, I teach, I work in a hospital, I've worked in an outpatient clinic before. I love sports, so I still like to discuss, football injuries, athletic injuries, how it impacts your fantasy team. I see I guess you're a big Steelers fan.
Yeah.
So, they've been doing pretty good. Old man Aaron Rodgers
Oh,
is, staying
jeez,
healthy
it's a
this year so
miracle.
far, knock on wood. Um, but it's one of those things where, I love to continue to learn as well. We have an EKG specialist at the hospital too, where, it's an ongoing joke because, time in the hospital is always, limited, and you're rushing to a patient's room because you're
Mhm.
like, all right, I think I got a nice window in there. And our EKG specialist there is Brian. And I open up the door, I see Brian in there doing his thing. And I'm like, damn, Brian, you beat me to it. I'll be back in like 15 minutes or so. So, just, every day's fun. It's a good time. But yeah, I mean, I would like to thank you for getting me on, just
Oh
trying to
yeah.
educate individuals, about a little bit about what we do, and certain things that we can help, just with the overall public.
Yeah, man. Yes. Man, thank you so much. Yeah, it's an honor. Hopefully get you back here again, and we could talk about more stuff in the future. Let's see what happens after this Super Bowl or next year. So
Yeah,
I'm sure there's going to be some more injuries out there we could learn about and see what's going on.
inevitably. Yep.
Yeah.
There's one thing that's constant. People are going to get hurt.
Yeah. They're
That's
gonna
what
get
keeps us in
yeah.
business.
Always someone is gonna get hurt. Yeah, so true. Well, is there a website or anything you have books or whatever? This is the time you just go ahead and give your socials out to the fans where they can find you and see know more about you.
Yeah, for sure. So, like I mentioned, on YouTube every Wednesday, I have like a show that comes out discussing NFL injuries and their fantasy impact. That's on the Injury Experts channel, Experts with a Z. That's the channel that and the company that Dr. Morse runs. So you may see me there every Wednesday, kind of releasing a new video. Um, Primarily, I'm on X, formerly Twitter, D Lorenz, DLORENZ, DPT. Um, that's my kind of handle there. And you can always find me if you just, kind of Google search my name. My page for the university that I work for is also there, kind of provides more of my background information. Haven't had any research publications or anything yet. Actually have a couple things in the works for that. So you may see that down the line. But yeah, so that's primarily where you can find me at.
Awesome. Awesome. Well, doctor, thank you so much. Folks, please follow him. He's on X at D Lorenz DPT. Give him a follow. And I'm sure if you have any questions about any of your favorite sports players, if they're on injury, you could ask him and he could probably give you some good
Mm.
insight to see how long it's going to take for them to come back to play. So, so that'll be good. Okay, doctor, thank you so much. Thank you, and thank you for what you do, and God bless. Okay,
Yep. Thanks, Jeff. You too.
pleasure. Okay, folks, thank you for tuning in. Till next time, God bless. Peace.
Thank you for listening to this episode on the Rascals Lounge podcast, and please don't forget to follow us on X and on your favorite podcast platform.